time. Talk to us about what was going on there and how this new board is going to bring about change.
Good morning, everybody. The new board and the new chief executive officer has already taken major steps in order to correct what was wrong. And the first thing that we have now implemented is to make sure that the service provider that was caring for our service users is been removed. And we have appointed the new service providers, which is going to be the nurses, registered nurses, that going to look after the service users. So we are making sure now that we are moving swiftly also to put the security in place so that the service users, which is our mental patient, are looked after properly. So those are the major shifts that already I have made sure that I deal with it in order to move forward and to correct all those wrongdoings.
So these allegations of abuse with regards to patients with mental health issues, have they been investigated, and what is the outcome?
In fact, the investigation is going on, is on. So as you have alluded at the beginning, that the previous board has been dissolved and the chief executive officer that was here is no more here. So I'm gathering all the information, and we are also putting our own investigation now to go thorough of exactly what has happened. Because if you look at also the things that we didn't have things like CCTV camera in order to trace some of the things of why what has happened. So, and we are trying also now to work closely with the SAPS, because if the matter has been reported to the SAPS, it means then the SAPS needs to act.
Right.
So I have already instructed my deputies so that we can meet with the SAPS so that we clarify where are we now and what are the steps that are going to be taken. So we are moving with speed so that we can make sure that this, what has happened, can never ever happen again.
Well, you say you're moving with speed. Let's test that. When was these allegations reported to the police?
These allegations were reported with the previous board and the previous management. So, and I have just been appointed in November.
When was that, sir?
That's why I'm saying that I am now following up with the SAPS. I've already arranging a meeting with them so that they can brief me of where they are and what is going to happen concerning those allegations. I have also instructed the management also to make sure that all the parents that have been affected by those service users in these matters, that we meet with them so that we also make sure that we put them on the light of what is happening and where. So we go with them in so that they know each and every step of what is happening.
Do you know the exact dates that the previous board reported these allegations to the police?
Apparently, they have reported in the early year, but I think mostly it was not the board, because the operation is run by the chief executive officer. Right. So the previous management have reported in the early this year.
So you've got a year almost that has gone past. What has come out? Why is it taking so long to get to the bottom of these allegations of abuse? Because you would admit these are serious issues.
That is why I said, as a new now chief executive officer, that is exactly what I want to follow up to find out what is exactly was the problem. But also we must remember that the important component, which is SAPS, because even if you look at the Mental Health Care Act, SAPS is a critical component that actually is supposed to work with mental health in dealing with some of the issues. So that is why I'm saying I'm putting in place that we meet with them so that we can get what is exactly where they are, what is stopping this investigation to be completed. But in parallel with that, we are also doing our own now as the new management now, our own investigation, so that we can get into the bottom of what has really happened.
I just want to explore the issues with regards to your communication with regards to the alleged victims' families. Are you in contact with them, briefing them in terms of each steps that's being taken in order to resolve this issue?
I have already instructed the management to set the meeting with them as I've just been appointed, because that is one of the things exactly that I want to do, is to brief them and take them step by step of what we are doing and what we'll be doing and what will be the outcome. So I've already instructed the management to set up a meeting with them. So soon, even before we close, we'll be meeting with them in order to keep them alert of where we are, what is going on now, and what we'll be doing.
So as it stands, this was reported earlier this year, the alleged victims of abuse, are they still in the very same place that they allegedly experienced this abuse?
As it stands now, there have been some movement and some are normal there. So they have been moved. And we are now, that's why I'm saying that now we have to follow, because some, the parents, they've taken them. Some, because of the alleged, it was mostly the deaths. So it's more of the caring of giving support to the parents and give them that counseling towards that. So it's different cases that we are dealing with.
All right. No doubt we will be keeping a close eye with regards to progress being made. Yes, sir, I want you to put a different cap on. I want to tap your brain with regards to, look, you in the space, and we in this festive season. Maybe you could give us, our viewers, some advice with regards to how to cope during this time, especially with regards to issues of mental health. The festive season is often associated with cheerfulness and merriment and so on, but for many people, this period, you know, you'll see a lot of forlorn figures. It can be a very depressing time. Give us some of the reasons as to why this season can be difficult, sir.
I think the first most important thing that we need to do as the communities is to have support. Because if someone is depressed or demotivated with whatever that is causing, either at work or at home, if there are conflict, it's very important to give support to that person. And also, I also encourage that people don't bottle things up inside until it's too late. So it's very important that if you feel that you are not okay in anyhow, it's very important to seek professional help. Right. Now, one of the things that I want to do now as a new chief executive is to make sure that when it comes to mental health, we educate people. We go out there in the communities and educate them about mental health, because you can look at things like depression. You can look at things like suicidal that are happening out there. As the matrix, they're going to be waiting for the results. Yeah. Suicidal, because maybe they are waiting for them to do well, and if they fail, that's going to be a problem. So I encourage the parents to make sure that they give those children support in order to be alert of such things that may come. So, but the professional help is very important, because like Durban and Coastal Mental Health, we offer it for free. So it's not something that it's always paid for. So you can get help for free, which will support when it comes to counseling and so on.
Oh, that's very interesting, because many people will not know that this can be free of charge. It's an important service that you are performing. I mean, you know, when we look at this time especially, we all want to have that perfect holiday, picture perfect, like we see in the movies or on social media. But, you know, we know a lot of the time what we see on social media is far removed from reality. So I guess, especially during this time, it's important not to have high expectations.
Yes, in fact, it's very important not to have those high expectation. But as I said, what is important is the support.
Yeah.
If the family has the support, but also from our side, as I said, it's important to be out there to alert the people, to talk to the community, to make them aware about mental health, to make them aware. But we are also inviting, because we are also an NPO that is funded by the department.
Yeah.
We want to work close with the department and make sure that when it comes to mental health, we put it at the center. Because most of the things, they come from mental health. And even if there is a physical damage, but it also affects your mental state. So that is the critical part of mental health. It plays in a human being. So the awarenesses, we need to strengthen them so that people are aware that there are these services that are there to assist them, to develop them, to support them, and also to make sure that it protects them before they have those expectations that they might do things that are untowards.
Yeah. Mr. Mtiyane, give us some advice here. I mean, we often actually act like superheroes during this time of year, trying to do everything, planning holidays, spending time with each and every family member. If you're lucky enough to receive a bonus, you'll spend it on expensive gifts. We also tend to drink a lot and eat poorly. Can this exacerbate issues like stress and depression?
Yes, when it comes to stress and depression, we can. You know, there is something that we call peer pressure, where when you are with friends and colleagues, maybe you will see that they are doing maybe the drinking or substance abuse and all that, because those pressures come too much for an individual to make sure. But the critical component that I've talked about, if you have a support service and if we also go out to the community, we teach the community already, if a person maybe is depressed or is stressed, maybe at home, the family is not coping, maybe financially or in any other words, or there is someone that is drinking too much and is abusing, like we are in the month of gender-based and all that. So ours is to make sure that we are out there, we educate them, and the service also is there. Because when we educate them about these awarenesses, it means then we must also offer those services all the time, so that because it's private also, you can't be, when you do counseling, you can't be seen by others, because some, they are scared that, hey, I'm scared to go there for help and all that.
Yeah.
But it's important that it's a free service that we can talk to you in a private space that can make you be free to be able to talk to us.
Lungisani Mtiyane from the Durban and Coastal Mental Health, the Chief Executive Officer. So we thank you for your insight and perspective. Be well.